I'm Michael Lincoff. I'm an interventional cardiologist and clinical trialist at the Cleveland Clinic and a professor of medicine at the Case Western Reserve School of Medicine.
I am Justin Echouffo, associate professor of medicine at Johns Hopkins.
Why should we cardiovascular specialists be focusing on obesity?
And one of the key reasons to focus on obesity is because it's a major public health and clinical problem worldwide. So, for example, the latest estimate of obesity from WHO indicate that more than 1.9 billion people around the world are overweight. And among those, more than 1.9 billion people, 650 million people have obesity. When we sort of look at the situation specifically in the US, the latest national estimate from the Center for Disease Control indicates that 42% of adults in the US are actually suffering from obesity. About 30% of the US adult population is overweight, and the figures are only going up. So if we look at the last 20 years, the prevalence of obesity has almost doubled. So, and particularly the prevalence of severe obesity. 20 years ago, the prevalence of severe obesity was about 5%, and more recently, it's 9%. And obesity is associated with a high burden of morbidity, premature mortality, and high cost of medical care. So if we look at the estimate from 2019, it's estimated that annually we spend approximately $173 billion because of obesity, and the excess in healthcare expenditure for one individual is about $1,800, to be more precise, for an individual who is obese compared to somebody who's not obese. When it comes to the consequence of obesity, as I mentioned regarding mortality, so obesity is associated with diabetes, which is a major risk factor for cardiovascular disease, and it's also associated with cardiovascular diseases themselves. Data from a large meta-analysis show that on average, when there is a 5-unit increase in body mass index, this will increase the risk of diabetes by approximately 72%. It will increase the risk of hypertension by 49%. It will increase the risk of coronary artery disease by 15%, and it will increase the risk of atrial fibrillation by 23%, and the risk of heart failure by about 41%. So in a nutshell, it's a major risk factor for cardiovascular disease.